Before I begin, I'd like to acknowledge the Ngunnawal people, who are the traditional custodians of the lands that I'm coming to you from today here in the ACT, and pay my respects to their elders, past, present, and emerging. I'd also like to acknowledge the continuing contribution of the Ngunnawal people to the life of this city and indeed this region, and also acknowledge the support that they provide to our organisation and also to our member organisation, ATODA, here in the ACT. And given the context of today's online event, I'd also like to acknowledge people with lived and living experience who are joining us today, and all of the work that they do in contributing to the AOD sector and indeed the broader sector in which we work. So thank you for joining us today. We're coming together to talk about supporting lived and lived experience storytelling in the media. And this is our online implementation workshop. So many of you will be aware that AADC launched a best practice guide for AOD services in media engagement and living experience storytelling earlier in the year. I think we launched it at the end of March. And we've had a lot of interest in that publication. So we wanted to have an online workshop where we could delve a bit deeper than the launch did in terms of putting those best practices into practice. And we're also joined today by our partner organisation, AIVL, who are going to talk a bit about their complementary resource, which is Reporting on Harm Reduction in People Who Use Drugs, which is a media and communication guide. So two different publications pitched at different audiences, but very complementary in terms of the messages that they're putting across. So that's what we're going to be talking about today. And as I said, these resources are ideal for workers across the AOD sector, including those in frontline service delivery and also those in media and communication roles and for media agencies that are wanting to engage with us as well. And we're going to have two presentations today, one from James Dunne, who is AADC's Policy and Projects Coordinator and did the hard lifting, the heavy lifting on our best practice guide. And James is going to talk you through some of the detail in that resource and give an opportunity for you to ask some questions and make some comments about that. And then we're going to be joined by Molly Howes. Molly is the Director of Operations and Communications at AIVL, and Molly's going to talk about their complementary resource. And again, we'll have some time for questions. So we've got about an hour here. In terms of housekeeping, just how we're going to run this mission, can you please pop your questions, comments, feelings, whatever, into the Q&A, not the chat. The chat is disabled. We didn't want to have two sets of conversations going. So if you pop your questions, comments, whenever you're ready into the Q&A, and you'll be able to see those go in. We're trying something a little bit more technical for this event than we have before, and we think we have enabled the voting capacity. So if you keep your eye on the Q&A and you like a question that someone else has put in, someone else has got to the punch before you and thought of an excellent question, feel free to vote that up. So at intervals, James and Molly will be stopping their presentations to have a talk about what is in the chat and respond to the questions that we've got in there. So without further ado, we might kick this off. James, do you want to start us off by talking about the best practice guide and in particular talking about some of the conversations you've had with organisations and services since the launch? That'd be great.
So thanks, Mel. Yeah, as Mel said, my name is James Dunne and I'm the Policy and Projects Coordinator here at AADC. I'm coming to you from the unceded lands of the Pangarang people in what we now call Northeast Victoria, and I acknowledge their ongoing connection to the place where I live and work. And as Mel said, I'll echo that acknowledgement about all the people lived and living experience who informed this work. It was really, we couldn't have done it without those voices helping shape this work and all the work that we do here at AADC. As Mel said, please feel free to make comments and put questions in the chat and all that sort of thing, and I'll try and answer them as I go. I'm hoping to make this as interactive as possible within the confines of an online format, and we'll see how we go with that. So I know some of you might have been to our launch event for the Best Practice Guide, so forgive me if I cover a little bit of that background detail first, but I think it's really important to ground us in why this guide has come about. And I'm going to be speaking today mainly about the Best Practice Guide, but it is worth flagging that we have an accompanying position statement which reflects the guide, but it's a bit more of a high-level sort of statement of principles. So both resources have application to our discussions today, but I'll mainly focus on the detail of the guide. So, to put it simply, the best practice guide has been developed as a way to reduce the risk of negative outcomes when people with lived and living AOD experience share their stories in the media. The focus of this work is on mainstream AOD services. We know that in these services there are frequently staff or board members in identified peer roles or who have their own lived and living experience. There's clients of services, there's family members of people who are accessing the AOD service who are also connected in some way. And importantly, we know that AOD services frequently act as a gateway for journalists to access stories of lived and living experience. Therefore, they have a key role in supporting a safer environment for this storytelling to occur. Just trying to move my screen across. And, oh, sorry, there we go. So why develop a best practice guide? Well, to put it simply, the media loves stories about alcohol and other drugs. And while the angle of this reporting varies, personal issues are a key feature. In fact, I was at the Tasmanian AOD conference last week and there was a panel on this very topic. And I'm paraphrasing the journalist here, but the journalist said that while data is important for informing a story, it's really the personal stories that move editors and draw readers. So, media reporting and sharing of personal stories has the potential to challenge stereotypes and deepen understanding of AOD use, as well as empower individuals by platforming their voices in issues that affect them. But AOD related stigma is pervasive, and AOD related stigma means that the sharing of personal stories in the media comes with significant risk. So, any publicity of personal stories has the potential to create a negative impact for a person sharing their story, even when the reporting is done sensitively. And some of these impacts could include impacts on family relationships where family members might not have been aware of somebody's drug use, people feeling exposed and increasing their AOD use as a means to cope with this, increased attention from law enforcement or negative healthcare experiences following the publishing of personal stories. And to illustrate this point, I just want to play a very short clip from our launch event, which featured journalist and author Jenny Valentish. Jenny has her own lived experience, and this was the topic of a book that she wrote called Women of Substances. So, in this clip, she describes the experience of being interviewed as part of the promotion for her book.
My experience is, I am a journalist. However, I put out an addiction memoir, Women of Substances, in 2017. And so my exposure to the press was entirely self-inflicted, but it was quite exhaustive. It went on for 4 months. So it wasn't an one-off interview, it was constant. And much as I tried to control the narrative and be fiendishly prepared, at the end of the day, often what a journalist is looking for is, how bad did it get? Are you okay now? And there are questions in between, but they are digging for that kind of rock bottom to redemption story quite often, unless it's on a specific topic, such as, I don't know, the meth epidemic. But in my case, it was very, very impactful on my health, I have to say, because being so vulnerable with a stranger, possibly live on air, over the course of maybe just 4 minutes, being asked the most personal questions, I found that my body was almost trying to shut down. I was breaking out in hives on my face whenever I had to do an interview. In hunter-gatherer times, if we made ourselves this vulnerable, we might die. So I think we've still kind of got that mechanism in us that tries to prevent us from being vulnerable.
So what we can see here is that even for somebody like Jenny, who works as a journalist and is familiar with the process of developing a story and is able to prepare herself for that experience, the interaction with the media was a profoundly negative one. And it highlights the risk that people who share their stories and it highlights the risks for people who share their personal stories and also demonstrates the duty of care that AOD service must have when facilitating access to staff, clients, and family members and others with living experience. And it's not only in the moment or immediately after that these risks or impacts occur. Once a person's story is out into the public sphere, it's there forever. So on the screen here is a selection of articles where people have shared their personal stories of AOD use, and I blanked out the identifying details here as I don't want to put these people's stories or these people's lives back into the public sphere unnecessarily. But these stories are now years old, and they include the participant's full name, meaning that anybody who Googles the people featured in these stories will have these articles come up. And it's not to suggest that these stories were necessarily negative or stigmatizing in any way. It's more to highlight that a person loses control of their story and their image once that story is published. So it's really important to consider this. So before I move any further into to talk about the guide itself, I might just pause and see if there are any questions. Mel, I can't actually see the questions while I'm sharing my screen. Is there anything that's sort of popped up there?
No, people are in your thrall at this stage, James. They're hungering for more presentation, I think. But I think, in talking to the services that we spoke to, and the reason that we wanted to have this event was as well for people to reflect on the experiences that they've already had and perhaps share those experiences with the broader group as well. Because I know that everyone has who's worked in this sector for some time has had these experiences. And, in putting together this resource, as James sort of highlighted, we were reflecting and riffing off the experiences of our member organisations that they'd had in this space. And, it's a bit on reflection, like the road to hell is sometimes paved with good intentions. And as James has sort of alluded to, and Jenny did as well, even when the media stories come out positive in the way that you would have wanted them to, just the very act of being that vulnerable and putting your story out there can have impacts that perhaps people didn't foresee. And I guess what we're wanting services in the AOD sector and related sectors to reflect on is, just because someone can tell their story and wants to tell their story, should they tell their story? And there's a bit of a duty of care there, really, in terms of AOD services and whether it's the right thing to enable people to tell their story and how they do that in a way that, reflects their needs and protects them. So we've got a question in the chat here now, James, from Jackie. While the media might hunger for a rock bottom to redemption story, we don't have to deliver it in that format. What can we do to resist that dominant narrative? And I think that's something that you go to a little bit further on in the presentation.
Yeah, that's right, Mel. Just to sort of briefly talk to that point now, I think part of the way that we can challenge that is for services to think about what the sort of messages they want to communicate and why they would want to engage in different media opportunities and what they want to see media reporting to be like, and how they want AOD issues to be presented. So I think starting out with that really clear idea of what do we want to achieve from this media engagement is a way to not fall into those traps of those sort of well-worn kind of tropes around AOD reporting. But I'll probably speak a little bit more to that as we go on.
Yeah, thanks, James. And probably just housekeeping wise, this is a good opportunity for me to plug the voting. So if everyone has a look at their chat where Jackie's question is, you can see the little thumbs up at the bottom. So when people punch in a question, if it's something that you also want to know the answer to, yeah, thank you, someone, for demonstrating that for me. Yeah, if you click on the thumbs up, it'll tell us how many people want the answer to that question. And so Jackie's question is already very popular with another 3 people saying that they want to hear a bit more about that too. So, oh my God, it's 6 now. So yeah, you see how this thing works, right? So if everyone would like to punch in their questions, it doesn't have to just be questions. It can be comments, it can be sharing, it can be whatever you like. But if whatever is in the chat is something that you relate to in the work that you've done and the experiences that you've had, you can use that little thumbs up function to let us know and we can talk about it a little bit more. So there you go. Off you go again, James. Sorry, I digress.
So now we're getting to the guide and the position statement. So the best practice guide and position statement represent AADC and our members' commitment to supporting a safer environment for people with lived and living experience to tell their stories in a public forum, as well as a way to challenge AOD-related stigma and discrimination. It was put together by a working group drawn from our member organisations and draws from their direct experience and expertise. And I've got everyone listed on the screen here who was in the working group, and there's too many of us to kind of go through in detail, but I do want to shout out their role and their contributions to this work. So how can you use the guide? I think there are three main ways that the guide can be used in your organisations and within your practice. From my perspective, the guide can be used as a statement of principles that organisations can adopt and contextualise to their environment. So I think the accompanying position statement might be really useful for this context, particularly where an organisation wants to make like a public commitment to a safer environment for lived and lived experience storytelling. We can also use the guide as a set of practices that can be translated into organisational policies. So this might be a policy around the process for media engagement, or a policy about when and where a service will engage with journalist requests. The third one is around a set of actions that individual practitioners can keep in mind when they are approached by journalists. So there's probably other uses, and I'd be interested to see in the chat if other people have identified other ways they could use the guide. And as much as possible, when we were writing this guide, we tried to be as avoid being prescriptive about the practices that should be implemented, and rather outline some questions and scenarios that organisations might want to consider, as well as giving some suggestions around the way that certain situations could be managed. And that's really because our sector is so diverse. What might work in a group day program might not work in a resi setting, or what might work for adults might not work for young people, for example. So what we've tried to do here is encourage services or individual practitioners to reflect on their practice and what they can do in the context and scope of their work to make a positive impact for that storytelling. So when myself and the working group first started discussing what should be in the guide, it became particularly apparent that the best practices don't start when a journalist meets somebody and sits them down and starts asking questions. The best practices really work across a continuum that spans prior to any journalist making an approach to a service, and continues well after that media engagement has concluded. So what we can see on the slide here is that continuum where we have actions before any media engagements, we have actions before accepting an opportunity after someone has contacted a service, during the engagement, after the engagement, and then the longer term shaping of the environment. And similar to the way I've described before, the points along this continuum can be used as needed within organisations. I think ideally all the actions would be used together in a really complementary and sort of reinforcing type of way. But even if you were to use those sort of three middle points on the continuum, I still think that goes quite a long way to reducing the risk and helping shape a more positive environment for lived and lived experience storytelling. So I'll step you through each of those points along the continuum now. And we'll start with this point before any media engagement occurs. So even before a journalist approaches a service for comment, there are a number of questions that services can consider and plan for to ensure a solid foundation for media engagement. And the theme here is around being proactive and considering what a service wants to achieve with its media engagement, how it can plan for this. We'll start to speak to that question that I think Jackie asked before in the chat. So the most basic question is, what is the service's position on providing access to clients and staff with lived and living experience? Under what circumstances would they agree to an interview or decline an approach? And under what circumstances might they refer the journalist onto a dedicated peer representative organisation such as AIVL or Family Drug Support in the family space? This might be informed by previous experience. It might be done in consultation with any sort of lived experience advisory group. There are any number of ways that an organisation might arrive at this decision. And secondly, a related question is how that service wants to see AOD issues framed in the media and what type of outlets are going to support this vision. Considering these questions can help move a service's engagement with the media from being reactive, as in responding when approached for comment, to proactively seeking out opportunities to progress those key messages and actions towards its vision. And lastly, when thinking about the profile in your organisation of people with lived and living experience who are keen to share their stories, how will issues of intersectionality be managed to ensure those sharing their stories are not subject to multiple forms of stigma and discrimination? We know that AOD stigma and discrimination intersects with other forms of stigma and discrimination, and that can increase the risk or exacerbate the impact of a negative outcome when somebody chooses to share their story. So considering all of this will vary depending on who with lived and living experience is involved in your organisation. And in line with the idea of being proactive and planned about your engagement with media, if services have a pool of people with lived experience who want to share their story, it can be really valuable to provide training to help them prepare for media engagements, work through the parts of the story that they want to share, and identify ways that they can keep themselves safe. There are a few organisations around Australia that do this sort of peer-based training, such as Newer in New South Wales and the AID Consumer and Community Coalition in WA. And if you know of any others, please feel free to put those in the chat as well. So the next point, so we've had this kind of planning out media engagement, and a service has been contacted by a journalist for comment or they perhaps pitch a story that they want to develop. So the first question I think at this point is for the service to consider is whether this particular story is best handled by that organisation, or whether it might be better handled by a lived and lived experience representative organisation, or even another service entirely. For example, if a treatment service is contacted regarding comment on a proposal to establish a drug checking service, it might be more appropriate to refer that journalist to a peer-based harm reduction organisation or a representative organisation such as AIVL, given that the profile of people with lived and living experience involved with that treatment service might not be the same as the ones who are using a drug checking service. Secondly, the history of AOD reporting issues by that journalist or that media outlet can be part of what's considered as well. So I know in each of our states and territories, I'm sure we can identify outlets who have a very poor history of reporting on AOD issues. So I'm here in Victoria, and some of the reporting on the proposals for a second supervised injecting facility in Melbourne were particularly bad. And in that sort of light, a service might decline to comment given the reporting history and the risks that creates of a negative outcome for anybody who chooses to share their story. And there might also be some scope for terms of participation in the story. So things like asking for questions in advance, having a review process, or the ability to edit a story afterwards, including the types of imagery that is used in a story. And while noting that a journalist doesn't always have the final say over their work. Working to deadlines that suit your service and the person sharing their story, rather than having to work to the media outlets' timelines, is also a useful thing to negotiate. And as well as having the ability to withdraw at any point, and withdrawing with any of the input that's already been provided. And then you can also explore options for participant confidentiality or anonymity, such as using a pseudonym. And I think this is also a useful process to test out the willingness of a journalist to, want to negotiate and report in an ethical sort of way. And you can, if a journalist is less open to these sorts of negotiating terms of participation, that might be a signal that perhaps this is not the best opportunity to engage with, and it might be a risk of a not so great final product. So once that engagement's been accepted, we can now turn our focus to how a service can support somebody who's decided to share their story. When somebody is keen to share their story, there's a bit of planning that can be undertaken with that person to reduce the risks of a negative outcome. So this might be working through the parts of their story that they want to share. And an important thing to ask here is, what do they want to get out of the experience, and what parts of their personal story will help achieve that goal? Every person will have a different reason for wanting to share their story, so it's important to kind of work through that. What's the line in the sand for that person, and what parts of their story are off limits? Again, this is going to be different for each person, and it can even change for the same person with each media engagement. And a related question to that is, how would they withdraw their participation if they are unhappy with how things are going, and what can the service do to support that? And that might include offering a debriefing or support post interview as well. And also considering what are the likely or possible positive and negative outcomes for participation, both now and into the future, and how are they prepared for that negative outcome, and what could they do to minimize the impact of this? Working through this might help a person clarify if they really do want to share their story at this point in time, or whether they might be in a better place for future opportunities. And an important question in the context of friends and families is, do they have permission from the person with lived and lived experience to share their story? This is a really tricky space to navigate because obviously family members and friends are impacted by somebody's AOD use and have their own stories to tell. But I think it's really important that we seek permission where that is reasonable, respectful, and free from coercion. So we've got to the point where an organisation has planned its approach to the media. There's an opportunity to participate. They've got somebody who's identified that they want to share their story and done some of that pre-planning, and now the cameras are about to roll. So even at this point, there are still ways that we can reduce the risk for that person sharing their story. This could be things like checking in with the journalist and the person sharing their story about whether the agreed terms of participation have been met. This could be whether, for example, whether those questions have been provided in advance, if that has been requested. We can also ask the person sharing their story if they would like a trusted person or an advocate to sit in the room in the interview and help ensure that those terms of participation continue to be met throughout the interview, as well as assist in withdrawing their participation if things are going well. And I think this is a really important point because it recognises the power imbalance that happens within these interviews and gives a bit of support for that person to, make a bit more of a balanced power relationship there. And after everything's wrapped up, we also identify that it's important to debrief with the person who shared their story. And this is critical for two reasons. One is that the interview might have raised some issues for that person and they might like some external support. And two, if the person interviewed expresses any concerns about the interview process or anything they said, these can be raised with the journalist as quickly as possible and hopefully addressed before any publication occurs. And lastly, the work doesn't stop after the interview or the publication of the interview, but it keeps on going as a continual process. As I've said a couple of times, the practices that we've outlined in the guide are designed to be adapted to each organisation's context, and this context is shaped by the experience it has with journalists and the media. So an important part of this process is to document positive and negative experiences or outcomes from each media engagement, and do that reflective practice so that policies and procedures can evolve and be improved on into the future. And broadening from this, we can shape that more positive environment for AOD reporting by sharing these experiences through our networks, including our state and territory AOD peaks, so that others can learn from these experiences as well. And when there has been some negative experiences, these can be communicated back to journalists to help them improve their practice. This might be an opportunity for journalists to understand the impact of stigmatising reporting and improve their work. And where there has been particularly bad examples of reporting, industry bodies such as the Australian Press Council or the Australian Communications and Media Authorities have complaint-making processes. And the AOD Media Watch website has a great case study on the process of that complaint-making. And lastly, we can build relationships with our peer-based representative organisations such as AIVL and other organisations that play a similar role like Family Drug Support so that we can refer media requests when appropriate and ensure that we lift up the peer voices in our sector. And before I finish, I just want to share a very brief personal anecdote that's been shared with me from somebody with lived experience who is involved with Family Drug Support. Her name is Cherie, and she's had some experience with the media. And she's been recommended by FDS as a really influential voice in this space for families. I've had to shorten Cherie's story just a bit, but I hope I'm doing it justice with my paraphrasing, and I do just want to thank her for sharing this with me. So Cherie lost her son Aaron to an overdose some years ago. She felt initially that speaking out about Aaron's passing would help the world understand that he wasn't a statistic, but a son who was loved unconditionally, and as such, she spoke at public events about him. However, from this initial experience and the grief attached with her decision, she felt regret about sharing the details of Aaron's life that went against what she describes as her protective instincts as a parent. She says that now, with reflection, time has provided more clarity, and it dawned on her that the privacy and dignity of Aaron and others like him shouldn't be compromised for the sake of public attention or media impact. An important lesson from this experience is the need for ethical storytelling that balances truth with care, and that engaging with the media should serve a clear purpose and contribute to meaningful change. So, for others in these similar situations, she encourages a process that gives them time and space to reflect, especially in the early days of grief or crisis when emotions are raw and decisions are made from a place of shock. She advocates for a trauma-informed approach where storytellers are supported emotionally before, during, and after media engagements. And now, when she does receive media requests, she asks herself questions like, why am I sharing this? What is the message and who is it for? And what changes am I hoping to inspire by sharing my story? And I think this anecdote captures the spirit of what we've tried to do with the best practice guide. And I do just want to thank Sherry again for sharing her story and allowing me to share it with you all today, as well as acknowledge all the work that FDS does in this space. So I will wrap things up there. If you haven't already accessed the best practice guide, it's up on our website, and you can just go to aadc.org.au, and there should be a link in the Q&A chat as well. And I hope this has been a really useful overview, and I'll just see if there's any questions before I hand over to Molly.
Yeah, James, we got quite a few questions here in the Q&A, and our AV people in a housekeeping way have pointed out that we need to stop referring to the chat. It's actually the Q&A. We want you to put your questions in. Just because we're having a chat doesn't mean we're talking about the chat. So there are two things going on here. The Q&A, which we're going to go to in a sec, but the links that we are giving you throughout this do appear in your chat. So the link to the best practice guide is there. We've also published earlier in the piece a link to some contacts for support if any of the conversations that we're having here today are a bit triggering, which they could well be. We've got crisis and support contacts in there, the National Alcohol and Other Drug Hotline, Family Drug Support, Lifeline, 1-800-RESPECT and 13-YARN. So we've published those in the actual chat, and we will do so again at the end of this event as well. But James, I might just refer you to the Q&A where our questions are coming in thick and fast. A number of these you've actually taken care of through your presentation, but I might just paraphrase and link a few of these up here because there's some themes. So the one that's got the most votes, you can see a little 11 thumbs up there on Emma's. We also need to balance paternalism and assist people to make informed choices, and also give them options for how they can tell their story, such as anonymously or in written format, not speaking directly to the journalist, which are all good points that I think you've covered too. And that goes to the question below that Michael's asked, I think, in that I think it's a bit of a catch-22 around the importance and impact of lived experience stories on people's recoveries, but also the potential risk of negative impact on the storyteller. And that, in a nutshell, is why we've kind of tried to develop this resource to help people consider how to balance those needs. Do you want to talk a little bit more about that, relating to what Emma and Michael have put in the chat there, or put in the Q&A there, James?
Well, thanks for those questions in the Q&A. Yeah, no, this was something that we really wrestled with within the working group. Obviously, as I said at the start, sharing those stories in a public forum really is empowering for the people who want to share their stories and feel really passionate about these issues. It also has the ability to challenge stereotypes and about who it is to be somebody who uses alcohol and other drugs, and all the different sort of stigmas and assumptions around that. So it is hard. I mean, we're not. We definitely don't want to be suggesting with this that AOD services should be restrictive and have a lot of power in determining who should be able to talk about their story and making decisions about, perhaps you're not in a good place to talk about it. It is, I guess, trying to develop a bit of a risk framework and working through with the people who are keen to share their stories, what that actually means and what outcomes could come from that, and empowering them to decide, yeah, this is something I want to do, or actually, I'm not ready for this right now. So I think it's hopefully we're pitching this as a supportive guide to help make that informed decision making from people who want to share their story, but also having some organizational policies that can reduce that risk as much as possible.
Yeah, I think those are good points, James. And we might just take a couple more before we go to Molly, because I want to give her enough time to talk. There was a question here from Anonymous about how we pick winners in terms of who to engage with in the media. And I think you kind of covered that in your presentation. Emma has also punched in a little plug there for Shark about their lived experience speakers. Julia asks a different question, which I think is really interesting here, but goes to the expertise of the AOD sector and using that expertise to kind of help people in this decision-making framework. So she says a lot of this can draw from the principles of AOD work broadly in terms of meeting people where they're at, dignity of risk for media engagement, as this is another activity which obviously has the potential to risk harms to the individual, and we need to think about ways to reduce these harms and equipping them with the information to make informed choices. She also asked the question on this, I wonder how motivational interviewing could support this decision making. I might just put a pin in that one because that's a really interesting question actually, and goes to how people can be supported while they still are engaged with AOD services, I think, in making decisions around this, particularly some of the stuff that, was it Sherry from Family Drug Support whose story you shared, just in terms of what the decisions people might make now as opposed to later on reflection, I think is a really important thing as well. And Ed has popped in some interesting examples of articles there that, how do we ensure that the story reflects the complex relationship between trauma and substance use rather than simplifying it into a personal failing or bad habit? And I think that goes to some of the points that you made, James, about it not being a quick and dirty news story. It's better when journalists are engaging over a period of time and you're having some control in the editorial process there. And I think that point around knowing how much the outlet and journalist has engaged in this space before can help mitigate some of that risk. There's an interesting one here from another anonymous attendee. What's the tipping point with de-identifying stories? If they are being so de-identified to a point where the story doesn't match any of what the person originally shared, is it still something that should be shared, or should there be more of a balance? And they note that there's not likely a straight answer to this one. I mean, I think there's a question in there, James, about simplification versus de-identification. Do you want to comment on that?
Yeah, no, it's a tricky question. Yeah, because you don't want to lose all the detail of the story and the kind of nuance and the, I guess, the heart of the story as well. It probably goes back to that question and for the person sharing their story around, working through what sort of impacts they might expect into the future, or what if possible, how they would cope with that impacts if they were to eventuate, and sort of working back from there around how much do they want to de-identify themselves when they're sharing that story. I know from some other communities that I've talked to in this sort of similar vein, that there's sometimes an amalgamation of different stories. It's one person that's presenting what seems to be a personal story, but they're actually drawing from a whole bunch of other people in the community and just presenting that as a single person. We also say in the guide as well that you can possibly talk in sort of third person around saying that sometimes, for example, people who use cannabis experience blah, blah, blah. So you don't necessarily need to say, me as a cannabis user, I experienced this. You can sort of talk in a more generalized sense. So that's another way around that kind of identification issue.
I think that's a nice segue to lead into what Molly's going to talk about, because it's about representing lived experience, not necessarily making it about the individual as well. I'll just cut through these comments here before Molly goes. Jackie says, I like the intention setting, but I worry that it isn't realistic to assume that telling a story to one journalist will create meaningful change of any sort. And how do we manage client expectations to what is really possible? I think that's a good point, but I also think it goes to anyone in the sector. I mean, how many researchers have you met that have done a piece of research and published it and expected the government policy was going to be influenced in some way? I think we all need to check our expectations. And I think that's part of, I guess, the context and background work that you need to help someone with, to understand that, yes, telling their story may not change the world, but it is contributing to a greater narrative. And so I guess that's a really important part of the conversation too. Michael says, would you say the focus needs to be more on the storyteller, making sure they are ready rather than relying too much on media agencies doing the right thing? Yes, is the short answer to that. And we have another person here who says they've shared their story with the media after being given a false sense of security. And it wasn't that their story was changed in the media, it was the headlines that completely shattered their sense of confidence regarding sharing with the media again. And I think that's exactly the kind of scenario that we're trying to illustrate here. Sometimes the road to hell is paved with good intentions, and that's the sort of stuff that you need to really make clear to people can happen. So you've got to be a really robust person to be able to engage in this space. And it's about helping people understand how that can go wrong in a multitude of different ways so that they do appreciate that before they kind of naively engage thinking that it's going to be a good thing to do. Molly, I'm going to throw to you now though, mate, because you've got a really excellent document as well that AIVL has done on reporting on harm reduction in people who use drugs. And this one's a media and communication guide that's driven by the community. So Molly is, as I said before, the Director of Operations and Communications at AIVL. So take it away, Molly. How have you guys gone with this?
Hi everyone. I just want to say I'm loving this already. The question box is going off and there's so many meaty conversations, and they're great conversations, right? Because there's not clear solutions to them, and it's kind of something I guess I hope we kind of all figure out together as we tackle this beast that is the media. Before I start, I just want to say thank you. Thanks, Mel. Thanks, James, and the whole AADC network for having me here today. And I'd also like to echo the acknowledgement of country that James said at the beginning, and pay my respects to elders past and present, and extend that respect to any Aboriginal and Torres Strait Islander people who are joining us today. I think it's also important for me to take a moment just to acknowledge that the laws and policies about alcohol and other drugs have had a disproportionate and devastating impact on Aboriginal and Torres Strait Islander people. And I think that's something that we all carry kind of in our collective consciousness as we move through this work together, trying to make this space more equitable. So at AIVL, we also like to take these opportunities just to acknowledge the legacy of peers who went before us and who are no longer with us, and those who strive for equity and social justice in the face of criminalisation. We reaffirm our work, our commitment to work alongside our community of people who use drugs, challenging stigma and discrimination in all of its manifestations. So like Mel said, my name's Molly. I'm the Director of Operations and Communications at AIVL, which is the Australian Injecting and Illicit Drug Users League. AIVL is the national peer-led peak organisation representing our network of drug user organisations and harm reduction programs in Australia. So we developed this media and communication guide, which is called Reporting on Harm Reduction and People Who Use Drugs, a media and communication guide by people who use drugs. It was developed with input from our network kind of across 2024 and the beginning of this year in 2025. It was developed by people who use drugs, and it really utilized their peer expertise. And it applies a harm reduction lens. So it aims to help reporters and people writing for or engaging in the media to ensure their coverage of people who use drugs has respectful language, decreases inadvertent harm, avoids stereotypes, and promotes an accurate and informed narrative. So while this guide it's really aimed at the media, I think it's a helpful tool for anyone who's working with the media. You can provide it to any media partners. You know, you can email it through to people, and use it as a bit of a checklist throughout the process of developing media pieces with journalists to ensure that a story is being crafted. The story that's being crafted is going to have a positive impact on the community of people who use drugs. The guide contains 10 tips that can be implemented throughout the process of developing media. And I'll go over these next, and I'll highlight the ones I think might be of most use to you here today. So for today's presentation, I'm going to focus really on tips 1, 2, 3, and 4, but I want to talk through all of them because I think it's important to give context to all of them. And within the guide, obviously, there's loads more information. It provides a lot more detail for each tip, and it also provides examples as well. So I'll just move through 1 to 4, and I'll talk about them later and then give a bit more context about the others. So number 1 is to use person-first language. And then we have avoid judgmental and stigmatizing terms, include the voices of people who use drugs, and let the community of people who use drugs choose their representatives. And number 5 is to focus on drug use as a public health issue. This is really about framing drug use in the context of public health rather than just as a criminal or a moral problem. We want journalists to highlight harm reduction strategies as a proven way to reduce health risks and improve outcomes for individuals and the whole community. And we think that this type of framing can really shift the narrative away from punishment and towards solutions that benefit the whole community, including people who use and inject drugs. Number 6 is to be accurate and specific when discussing drug-related risks. This one's really about encouraging journalists to not overstate the dangers of drug use that can perpetuate myths and increase stigma. And it's about encouraging them to provide accurate, evidence-based information to help their audience better understand the situation. Number 7 is to avoid linking drug use with violence or criminality. The media often conflates drug use with criminal behavior or violence, and this is a really tricky one. It obviously reinforces harmful stereotypes. And when reporting on drug use, we want journalists to be clear about the context and to avoid implying that drug use inherently leads to crime or violence. And we think that this has the potential to shift the focus from individuals to broader social issues and avoid portraying people who use drugs as inherently dangerous. Number 8 is to highlight harm reduction as part of the solution and not the problem. Harm reduction measures such as needle and syringe programs, opioid dependence treatment, supervised injecting or drug consumption rooms, and even drug checking are often misunderstood in the media. We see this time and time again. And while evidence shows that harm reduction services play a really important role in the community, you know, they've reduced costs to the health system, they reduce impacts of overdose, and they increase individuals' access to services, including drug treatment, and also people's access to education. We want journalists to emphasize harm reduction services' role in protecting both individuals and the wider community, not just perpetuating the misinformation that these programs in some way only encourage drug use. Number 9 is to avoid creating a divide between drug users and the community. People who use drugs are part of the community, and so framing them as outsiders or a threat to the community, which we see so much in the media, and we all know this can only increase stigma. So number 10 is to provide context when reporting on drug use trends. When covering increases in drug use or overdose rates, Really want journalists to make sure they're providing all the appropriate context and to explain the social, economic, and health factors that contribute to these trends rather than solely focusing just on numbers. We think that this can really help avoid sensationalizing drug use, and it'll help readers understand the broader factors at play. So if we go back to tip 1, which is using first person language, something I know that, you know, we're all more than aware of and something that I know everyone will use in their day-to-day practice, but it's something we see so little of when the media are discussing people who use drugs. I did like a super quick Google before this presentation and I found this article within a couple of seconds from South Australia's The Advertiser. This came out earlier this month. And so if the editor or the journalist who drafted this headline was using our media guide, it would suggest that instead of using a drug name to identify someone, the guide would encourage them to use person first language, which would look like a person who uses methamphetamine instead of the term meth mum, which is obviously abhorrent. But although like in this situation, we question if even the use of methamphetamine is relevant to the event at all, and that we know methamphetamine doesn't, like using methamphetamine doesn't necessarily mean someone is drug affected and potentially doesn't necessarily correlate to why this obviously tragic event happened. We know there's maybe lots of other motivations at play here, which maybe we can talk a little bit more about in the Q&A, but it is tricky when we know that media institutions, they need clicks to get ad revenue, and that's how they fund themselves. And so the more sensationalist the headline is, the more clicks they'll get and the better that article will perform in terms of how much money they get. And something we've also learned recently is that like you might be working with the best journalist, but they have no control over what the editor decides that headline is. They have very little power in that situation. So it can be really tricky, but we would hope that if a journalist was using our guide here, that this terminology of meth mum wouldn't happen. I think that the themes in that article that I just shared also links to tip number 7, which is to avoid linking drug use with violence or criminality. You know, in that situation, there's no evidence that those things are linked, yet they are so closely linked in the headline. It also links to the second tip, which is to avoid judgmental and stigmatizing terms. And this is something I wanted to go into a little bit more. So we all know that certain words can carry moral judgment or blame. And we wanted to encourage journalists to reframe their language to avoid creating like a good versus bad narrative or an us versus them narrative. And we made a couple of suggestions on how to do that. So instead of using the term clean when referring to a person's drug use, something we still see in the media quite a lot, using terms like currently not using drugs or a person with a lived experience of using drugs to describe a person's relationship with drugs. That type of terminology avoids associating drug use with dirtiness or moral failing and keeps the focus on health and well-being. Another example is instead of substance abuse or drug addiction or drug abuse, just using the term using drugs. What people spoke about when we were developing this guide is that, you know, not all drug use results in harm and not all drug use is problematic. So using terms such as addiction or abuse creates an automatic association between the drug use and harm or uncontrolled or problematic use or even violence when none of those things may exist. Tip 3 and 4 are to include the voices of people who use drugs. and let the community of people who use drugs choose their representatives. And I wanted to go into a little bit more detail about these points to close out the presentation, as I think this is really where the AIVL network and your network have a great opportunity to support each other when it comes to tackling the media. One way to humanize reporting and avoid stigmatizing narratives is to include perspectives of people who use drugs. Centering their experiences can provide a fuller picture of an issue and challenge common stereotypes. However, it is important to make sure we don't place people in vulnerable positions, which is what the AADC guide outlines so well. And it's the reason why we're all here today. We know this issue too well. We know that it can be tricky. Drug use is criminalized, it's stigmatized, and asking someone who has little or no experience with the media to talk about their own criminalized and stigmatized practices publicly, we know it can endanger them, it can hurt them, and unfortunately, it can also have a negative impact on the public discourse. But every state and territory in Australia has a harm reduction service, which is run by or employing people who use drugs, and having this resource is actually really unique in the global space. Australia is one of the only countries to have a drug user organisation in every jurisdiction. And the people that work in drug user organisations or peer-based harm reduction programs often have quite a lot of experience working with the media, sharing their own stories. And they have a lot of knowledge about the big picture issues that are affecting a broad range of people who use drugs. They are also likely to have established formal and informal peer support networks within their organizations and within their own communities, should there be any difficulties that come from speaking out. And you can absolutely connect in with your local peer org for media representation or for support crafting media narratives like what James was talking about. That it's a process, and sometimes it starts way before someone contacts you for comment or for a story. And at that very beginning point, that might be a really nice time to connect in with your local peer org, and they can support you in crafting these media narratives as well. AIVL is the peak body representing these organizations nationally. So if your local organization doesn't have capacity to support you, you can absolutely contact AIVL and we can offer some of that support as well. I've just put on the slide here all of the local orgs. They're also on our website as well as contact details. I'm sure most of you know your local org anyway. But just before I close up, I wanted to encourage you to use the guide as a tool when you're working with media, alongside the AADC guide as a bit of a framework, and to encourage any journalists you work with to read the guide, to implement the guide. And I just wanted to reinforce that you can lean on peer orgs for media representation and support, and AIVL is here to support you as well. Thank you for having me. I'll pop the link to the guide in the chat if it's not in there already. And yeah, keen to answer any questions that you might have.
Awesome. Thank you, Molly. We've only got a couple of minutes left to go, but I will throw to some of these questions in the Q&A. And some of them are comments as well, which is really helpful. And they do follow on from the comments and questions in the previous session. But I guess just before we wrap up, what we're trying to deliver today is the point that we've got a best practice guide for AAD services to help you think about some of the considerations you might need to have and some of the conversations you might want to have before you do the engagement. And we also have AIVL's reporting guide that is designed to give to the media to help them do a better job. So it's two sides of the same coin. So when you do engage with media, it is really great to provide them with that reporting guide to help them, to do this, because a lot of them are working in mainstream spaces and they don't have a health background. And so it's a really helpful resource. And if we're wanting them to do the right thing, the least we can do is try and provide them with the resources to help them do that. Molly, I might just throw to a couple of these questions, and some of them we might take on notice and we can engage with after the event is over. One's a straight language question that I think you'll be able to do easily. One anonymous attendee is asking, what about trying to make that distinction between someone using drugs and someone who is using drugs problematically, which you already spoke to? Would drug challenges or problematic drug use or similar be preferred? Can you just flick again to the preferred language in your guide there?
Around talking about problematic drug use.
Yes.
Yeah.
So, and the distinction between someone who uses drugs and someone who uses drugs who has a problem with that, just how that language can be nuanced for someone who doesn't have that background.
Yeah, I think what we would do in that situation is just to kind of name it how it is for that person, and if they think their use was problematic, then it's okay to say that. I think it's the issue comes up a lot in the media when someone might be talking about their drug use with a journalist, and then that is interpreted inherently as that is problematic when that person might not have felt that way. It might not have been problematic for them. And so I think it's just about, yeah, being more specific, asking journalists to put aside some of their own biases and really listen to what someone is telling them about their own experiences.
Yeah, thank you. And I think we might just wrap up on a really thoughtful comment we've got in here around overrepresentation and stigmatization and the tension between the two in terms of both language and policy. So another anonymous attendees talked about smoking rates and them being higher among people experiencing socioeconomic disadvantage, Aboriginal and Torres Strait Islander communities, and those with mental health issues. And the taxation policy and media reporting unintentionally deepening stigma towards these groups when talking about overrepresentation. And they're talking about how even with the best of intentions, some of this commentary in the media around the overrepresentation of marginalised groups in terms of drug use, whether that be legal or illegal drug use, can unintentionally entrench stereotypes. I know that's something that you've considered in terms of the media guide, and I guess it goes to that deliberately not using judgmental language. And I think it ties to another comment we've got here around acknowledging a trauma-informed context to drug use in many contexts as well. Have you got anything? I mean, this is why this is a hard space and why we provide these guides to help you have conversations, but we don't give you the answers because they're not straight answers to have. Molly and then James, do you want to reflect on how we highlight overrepresentation and disadvantage without inadvertently playing into stereotypes?
Yeah, look, it's a big question, and I don't have like a straight shooting answer, but I think it's again about asking media and journalists to just think a little bit more critically or express that to the audience around why that may be. It's not just that these particular groups, whoever it is, are doing this particular behavior. It's more that there's wider factors at play here. And so asking journalists to also represent that. I think there's a tip in the guide about providing more context. And that is a really important thing for the community is to often things are there's a lot of bias put on it. So just taking that step a little bit deeper and using often more words to describe a situation rather than less, which can be tricky when people have word counts or whatever, but this is part of our job, right? To support them to make the right decisions, and maybe they do need to use a little bit more words rather than less. But I don't have a clear answer, but we're gonna figure this all out together, right? That's what it's about. I did want to just really quickly make another point that I think it's really important that it might have been mentioned in the Q&A box, but if you do have a really good experience with a journalist, to please share that experience with people, um, and and we can support that journalist to have more access to our services, because I think it's really worth investing in good people that are working in the media and upskilling them. And so I think, yeah, that's an important thing to do. If you have a good experience, please share that with us all, and we can support that person further.
I think that's a really good point, Molly, and James covered it as well in his presentation, and how we can share that knowledge through the state and territory peaks. So if anyone has a great experience, it's good to share that through the sector. It's good to know where the safe spaces are when we're doing this engagement, I think. Can I just remind everyone before we finish up as well that we've got the crisis and support contacts that are in the chat there if this session has raised any issues that you feel like you need some support around, because this stuff isn't easy. And I think what James and Molly have been trying to say is the world is made up of shades of grey and it's not all black and white. And all we can do is sort of be thoughtful in how we do this engagement. And we hope that the guides that we have developed for you, both for our sector and adjacent sectors, and also for you to give to journalists who are engaging in this space, provide a useful framework for that engagement, and provide some tips for new players from those of us who've been around for a while and may have learned some lessons the hard way. So thank you again to everyone who has contributed to the development of these resources by AADC and AIVL, and we hope that they are really useful to people going forward. And we're really happy to engage further on this topic. You know where we are, you have our website details, and we're always happy to engage further if you have specific questions. But we will be popping this online event up on our website in video format. So if you have any colleagues who haven't been able to join us today, this will be up on our website so that they can see what we've talked about today. So thank you everyone for joining us. We are going to have to wrap it up because we're now 6 minutes over, but thank you for coming, and thank you to Molly and James for your really thoughtful presentations and for the work that both of you are leading in this sector and for our organisations. And also thank you to One Vision, who continues to support our online events and help us do the tech when we don't have those skills ourselves. So thank you so much to you guys as well. And thank you everyone. Hope you have a good week. See you later.